welcome again to Minds Between Languages. In this installment, we discuss public service interpreting with Elisabet Tiselius. Welcome to Minds Between Languages, Elisabet. Thank you for accepting our invitation. It's great to have you.
Thank you so much. Thank you for having me.
Thanks. So you're not only an expert in conference interpreting, but also in community interpreting. Is that right? And I hear a lot of words: community interpreting, public service interpreting, dialogue interpreting, so many things. What are we actually talking about?
Yeah, what are we actually talking about? Yes, this might be a little bit counterintuitive because I just published a chapter in the Handbook of Conference Interpreting about the differences of conference and community interpreting. So having said all that, it might seem a little bit stupid to say that I actually prefer the term public service interpreting. But yes, I'll give you a background on that. There are so many labels on this thing. And the thing we're talking about is when an individual is seeking help from authorities in a particular country. So the majority language speaking authority needs help to understand the individual. The other thing in there is also that an individual is looking for help with a very particular case for that individual. So it might be an illness or a refugee dossier or something that is very directly impacting on the individual, whereas the authority is sort of impersonal. It's not whether that individual gets the help they need or not. It's not fair to say that it's not of interest for the authority, but at least there's no emotional interest in it. So in this thing, an individual of one language, of a minority language of some sort, or immigrant language, is seeking help with an authority speaking a majority language. And then we call that maybe dialogue interpreting, but I don't like that because I think that dialogue interpreting is the mode, like simultaneous or short consecutive or long consecutive. And although dialogue interpreting is used a lot in these encounters, it's not the only technique that these interpreters use. And then community interpreting has been around for quite a while, and that's also why we used it for our article. First, it was a nice alliteration, community and conference, and then it's also a very established term. And the reason I don't like that is that it implies that the only person who needs the interpreter is that migrant or minority language speaking community, and also perhaps that the interpreter belongs to that community. And I like, rightly or wrongly, but I like this institutional aspect of interpreting. So interpreting is a public service provided by the public services within the public services, and also there's a need for everyone of that interpreter. So the individual seeking help needs the interpreter, the public services needs the interpreter, and the interpreter ideally is not particularly related to any of the two in the meeting. So that was a very long introduction on why I prefer public service interpreting.
No, but it makes it perfectly clear. Thank you so much for that. Yeah, then there's public service interpreting now, as I understand, and not community interpreting, but public service interpreting. There's conference interpreting too. What are the differences?
Yeah, that's what I have been trying to flesh out, both in that article I just mentioned and also in quite a big research project recently, because what I think that the task itself, I mean the interpreting, the transfer of a message from one language to another, is very similar. And the required skills for doing that is also very similar. So why is there a difference? Why do we label them differently? Why don't the same people work with public service interpreting as with conference interpreting? And then looking at it, the things that differ is the profile of the interpreter, the skills the interpreter has, the setting where they work, the directionality, users of interpreting, the users of their services. unfortunately also the working conditions and the degree of professionalization. So it really makes them two different activities, we may call them that, but within the same big realm of interpreting. So, and it's also, you could say two different professions, but not really, because they are so much overlapping in so many aspects. So I wouldn't say that it's definitely two different professions, but definitely, but absolutely two different activities within interpreting.
Two worlds in the same universe.
Yeah, you could
The
say
same
that.
solar system. Yeah. And now most interpreting scholars actually focus more on simultaneous interpreting or conference interpreting. Yet you also study community or public service interpreting. Why? I mean, what is your motivation?
Yeah, because I was sort of driven by the idea. We talked about the different profile of the interpreters and also the directionality, and then we have these the public service interpreters who often have much shorter training, if any training. They are clearly foreign language speakers of the majority language, very often, not all the time, but very often. And they they are less paid and so on. And yet the task they're doing is, from many respects, perhaps even more important than the conference interpreter, because they're on their own. They have a big responsibility for the health or for the judicial consequences or so for the individual seeking help, and also for the institution, for the doctor treating a patient, for instance. What if the interpreter does not manage to convey the ailments of the patient, right? So I had this sort of feeling that they must be as cognitively demanding, although there are different groups doing, or different profile of interpreters doing these two tasks. They must be at least on the same cognitive level. So why are we cognitively so interesting in the work of the simultaneous interpreter and not at all in the community interpreter? And then the cognitive task is perhaps not the same as for the simultaneous interpreter, because they don't, in most contexts, they don't work simultaneously with, you know, the ongoing speech and the ongoing output. But the language transfer situation and also the management of the dialogue is a cognitively taxing task. So therefore, I got interested into looking into the cognitive aspects of dialogue interpreting, or the public service interpreter. So I focused on the public service interpreter, but the cognitive load within the dialogue interpreting task.
Thanks a lot. Yes. If I understand correctly, it's a huge responsibility with a huge cognitive load, and so this is your motivation basically to research on that. And now you conducted a big research project exactly on the cognitive processes underlying public service interpreting. What does your research tell you?
Yes, it told us that it is definitely cognitively demanding, but there are different types of demands. It was quite clear that there were different types of demand. We did, for instance, working memory tests with our interpreters, and we had the idea that they would be, the experienced public service interpreter would be as successful in the working memory tests as the experienced simultaneous interpreters were, and they were not. So, by saying they were not, what we did was using the same tests as was used previously by Timarova for simultaneous interpreters, and we reused them for dialogue interpreters. And there may be many reasons for the fact that they didn't perform on the same level, but one of them may be quite definitely that we didn't test the reasonable skills for that task. So there are different skills for being a simultaneous interpreting than for being a dialogue interpreter, if you wish. And one of the concepts that became more and more clear to us while we were working with this was monitoring. the concept that we propose, which is perhaps not exactly the same as how you understand monitoring in the cognitive discipline, where you see the central executive as the monitor of the activities in the brain. But we see then, with the analogy, we see the dialogue interpreter as the central executive of the dialogue, right? So monitoring the different tasks that are going on in the dialogue. And we've framed it in a sentence saying that it's a cognitive process, and they use it to observe, evaluate, and take action in relation to their own cognitive processing, but also to the other participants in the event. So the interpreter has to both make sure that they understand the input and that they can output that in an understandable way in the other language, but also relate to the other people in the conversation. So making sure they were understood, making sure that their interpreting conveyed the same thing or the same message as the original, and also making sure that everybody has access, of course, to the conversation. So therefore, this monitoring capacity was what stood out as a different entity than other types of interpreting, maybe.
Absolutely fascinating. Can you maybe give us some examples? How does this monitoring look like? What do they do?
Yeah, what do they do? Well, the most concrete thing is perhaps that because it's not simultaneous, you can't offload the input with an ongoing output. So you have to remember what you're then going to translate in the sort of interpreting phase. And then you have to monitoring that the input, both that you understand everything, that not just the language, which is obvious maybe, but terminology and concepts and so on. But you also have to monitor that it doesn't get too much. So meaning that you have to, I mean, we know from research in conversational analysis that interpreters work a lot with turn taking, that the interpreter in some way has to be responsible for how the turn taking is working in the interpreted event. Researchers like our Swedish colleague Cecilia Wadensjö has shown that, and Laurea Gavioli has worked a lot with that. So we know that turn taking is an important part of interpreting in a dialogue. But what we also saw now is that the interpreter is actually steering the turn taking not only in relation to output and the participants, but also to their own memory capacity. Because if the utterance is too long, they will forget.
Yeah, sure.
And for experienced interpreters, their task is, of course, not to forget. So, and at the same time, you do not just interrupt and say, sorry, I have to interpret, because that doesn't really provide a smooth interpreting as well. So working with turn taking in order to manage your own memory capacity is one important thing as part of the monitoring.
Absolutely. Now, you mentioned experienced interpreters. If I recall correctly, you also had a group of less experienced interpreters.
Yes.
Is that right?
Yes, so we did, we had so many tests. So we had two groups of interpreters, experienced ones and inexperienced ones. The experienced ones had to have at least 4 years of experience and also have the Swedish certification or authorization for interpreters. And the inexperienced interpreters were either recent graduates or students at the last term of our public service interpreting program. And we had 3 different languages, so French, Spanish, and Polish, other than Swedish. Of course, Swedish was the common denominator. And these 2 or maybe 3 groups covered, they were so 17 people. And now you may say from a cognitive perspective and cognitive research that 17 is not a lot, and that's true. But when you look at all the data we collected, it also had to be managed in one way or the other, and then 17 was a lot. So these interpreters, they did a language proficiency test. So just a simple dialang test. I'm not sure if you're familiar with that, but it's an online test that levels you on the CEFR scale. They did working memory test. We even had an emotional intelligence test, which we haven't looked into yet, but I'm hoping to get around to that. So that was part of the test battery. And then they did simulated interpreted situation. So they interpreted in a dialogue context for around 15 minutes. And during that interpreted event, they also wore eye tracking glasses. And after the event, we had a small post-task retrospective interview with them. So with all this data, we tried to cover all different aspects of, we said we wanted to open the black box of dialogue interpreters, but, but maybe trying to cover all different aspects of the cognitive load in dialogue interpreting.
In each case, you're looking at the black box from different angles, and that's already
exactly
a lot of work. But could you observe any differences between the inexperienced and the more experienced?
Yes, a lot. The concept of professional self-concept was really applicable here, because one thing that we could see on a more general level was that the experienced interpreters could handle the situation better, if you see what I mean. You have this sort of higher perspective, or seeing the conversation from a
meta level, or
on a meta level, yes, perhaps. So which meant that when we went down into the nitty-gritty, like the turn taking or like using body language and so on, they were much more in control of that. Depending on where we were in the conversation, the turns were more or less the same between inexperienced and experienced interpreters. So maybe indicating that there is a limit to how long you can remember in a turn. But the experienced interpreters, they had more correct renditions of the turns. So meaning that they were both very aware of when they had to come in with their interpreting, but there was less omission and more close renditions for the experienced interpreters. And also when we looked at the direction when you interpret, because the dialogue interpreters work bidirectionally, of course, so working into the two languages in the meeting. And you also work as compared to, because you may have bidirectional simultaneous interpreters as well, but then there are longer chunks usually into one language. But here it's really utterance by utterance, and you change every 2 utterances, right? And when we looked at directionality, the cognitive load was less important for experienced interpreters when they interpreted into the language that they had stated was their weaker language. So now you may wonder whether, we asked them, we both did the dialang test to check their language levels, but we also had them state themselves which language they thought were the stronger or the weaker one. Which in some cases did not correspond with the test results. So that was an interesting finding. But what we saw was also that when they so both groups interpret into the 2 directions, but for the experienced interpreters, it seemed to be less cognitively demanding, although cognitively demanding, of course, interpreting into the language you experienced as the weaker one.
That is super interesting. And you said you use simulated situations. Now I'm wondering, how can you simulate a dialogue? I mean, doesn't the content of the dialogue not always depend on what happens in a situation?
That would be the immediate reaction from any reviewer. Yes, but is this an ecologically valid situation? And of course, no, it's not. What was important when we devised this design with scripted role plays was that we really wanted to see the whole development of a conversation. So not just stick to a sentence or a word, but really the interaction within that conversation. But then at the same time, since we put eye tracker on them and wanted to compare different rich points, so different areas where we had put triggers in terms of terminology or lists or then we couldn't just have any conversation, right? It was important that the things more or less came up at the same place, that the conversation developed more or less in the same way for all the 17 participants. And therefore we devised the role plays. And the role plays were a conversation between an employment officer and a job seeker, and which would be, you know, we use terminology and the development of the dialogue that would happen normally in those kinds of encounters. And then we had actors rehearsing them, so they didn't have to act it like a play, but at least rehearsing the lines so they know more or less where they were in the role play. And we also gave them instructions like don't let the interpreter interrupt, or get annoyed with the interpreter, or interrupt the interpreter before they finished, and things like that.
Sounds like a lot of fun.
Yes, it was mainly a lot of difficulty, actually, because what it turned out that it's very difficult, for instance, to in the course of a normal conversation, you adapt to everyone in the conversation, right? So even if we told the participants that you're not supposed to let the interpreter interrupt, you could still see that the role players adapted to the interpreter. So after a while, they knew they shouldn't let the interpreter interrupt, but they spoke in shorter segments to allow for the interpreter to interpret. So, you know, so these and these sort of instincts that we have in conversating with each other, they're so strong. So it's really difficult to, you know, overrule them, even if you have a manuscript, even if you know.
It must be terribly hard for them.
Yeah. So, but this means that we got, and then you may say that it wasn't a natural dialogue, and no, of course it wasn't. But the interpreter did not know. I mean, they knew that they were going to interpret at an employment encounter, because that you would know that if you're assigned as a dialogue interpreter. But they didn't know what it was going to be about. So the interpreter, for them, it was really a new situation. And also the actors had to adapt to the interpreter, and obviously they did. So even if they knew after a while by heart what was going to happen, they still had to adapt to a new interpreter. So I would say that it had at least a flair of naturalness. And the good thing was that we could also, you know, these rich points or triggers, we could really observe them across all the participants.
Yeah, you could compare. Yeah.
Yeah, exactly.
Very interesting. Yeah. Now, I would like to move on a little bit on more, let's say, professional aspects, or more on the work conditions of public service interpreters. Now, you conducted also some research on the simple fact, or the reasons why certain service providers maybe do not access or do not use interpreters for some reasons. Also, what we can observe a lot is that many service providers now use translation apps. And I was wondering, what is your personal stance on that? Do you think that a translation app could ever replace an interpreter in those situations?
Well, you should never say never, because look at where we are now. But so what we saw, so this was a completely different line of research, but I collaborated with a group of researchers in healthcare studies, so nursing basically, and looking at the communication over language barriers at a hospital in a clinical ward. And what we were interested in was the use, you know, even if, I mean, in Sweden, it's not a money issue. It's not really a provision issue, because we have very good interpreting agencies who provide interpreters on a, you know, they are hired on contracts and so on. But still we saw, and also in the clinic we were, there was absolutely no restrictions on using interpreters. And still we saw that there was a fairly low level of using interpreters. So we wanted to try to understand why they don't use interpreters, even when they have everything is made for them to use interpreters, and still they don't. And what we saw, apart from maybe that You can't have interpreters there all day. So it's difficult to, ideally, there would be one in the corridor all day that you could just turn to. And that, of course, was not. But apart from that, it's quite difficult to use interpreters. And I don't think that we think about that as interpreters because we know so much about it. So to us, it's obvious. Why don't you, just call us and we'll be there and help you. And we don't realize that it isn't just call us. It is knowing who to call, when, what to ask for. For instance, in a clinical ward where I don't know if that patient that is there today will be there tomorrow. I don't know if the doctor maybe needs an interpreter tomorrow. So when tomorrow comes, either I booked an interpreter that we have to pay for, and even if I won't be punished for that when it's not used, it's at least it feels bad to, spend money that could otherwise be. Or I'm there tomorrow and it turned out that we really needed an interpreter after all, but then it's too late. So this whole system of using interpreters is quite complicated, and it's not something that you intuitively as a healthcare staff will say that, oh, I know how to do this and I'll fix it. So there's a lot of systemic hurdles into using interpreters. And you could also say that you could argue that, but on distance, just call them and they will be there. But also then you have to, again, know not just there, because call them might be easy, but also knowing, did I get the interpreter with the right language combination? And that interpreter that I have on that phone, they couldn't hear me well. And it was really a much harder discussion because the interpreter was there than had it been just the father interpreting for the family or something like that.
And sometimes it even starts with knowing the native language of the patient, right?
Exactly. Yes.
It's not always so easy to find out if that person's
No.
speaking in Darcy or Farsi or
No, and you think that you just take that with Dari and Farsi. So Dari from Afghanistan, but also being a dialect of Iran.
yeah.
And Afghanistan and Iran having very different systems. So a Dari speaking interpreter from Iran would not necessarily interpret correctly for a Dari speaker from Afghanistan. And also many Farsi speaking people in Iran think that they speak Dari, whereas Dari speakers would say that, no, you don't. So, and then you try to get the right interpreter and you may end up with, something that wasn't at all what you thought. And on top of that, sorry to stop to a while on Dari and Farsi, but on top of that, you also have many refugees from Afghanistan who grew up in a refugee camp in Iran, and thereby speaking something in between the two. So might not be easy to identify which language people speak either.
Right.
So having gone this far in trying to explain the situation, I would say that what translation app is doing, at least in Sweden, the things I see in Sweden currently, is that they are filling a void where there wasn't an interpreter available anyway. But now there is something that allows us to communicate. And there are some translation apps which are not just Google Translate or DeepL, but which is actually more like let's say, a conversation lexicon for the healthcare services. So if you have an app that has been developed by people who are trained healthcare personnel, maybe in that language or at least with that language, they can develop standard sentences like, I need to x-ray you, or we have called for an interpreter, or tomorrow we're going to use, you're going to be called to another examination, and things like that, which really makes life much easier for people in healthcare services. So I would really hope that this is not something that replaces interpreters. But I also see, at least in the healthcare, all these situations where you would never have an interpreter there anyway. But then if you have the translation app, the patient will at least get the information.
Right.
And then, although I understand that the language models are getting bigger and more powerful and so on, but considering how erratic conversation is. I think that we really have some time to go before we can have that kind of automatic translation provided immediately with in, for instance, a healthcare setting, and thereby fully replacing an interpreter. I don't really see that happen very fast. Also because we're not, at least in Sweden, we're not dealing with the big languages, but fairly small languages from fairly different regions. So I wouldn't say that it will never happen, but at least I think that it will take some time.
And you also have the cultural context, right?
Exactly. That's what I was going to add. And on top of that, I also think that it might be good to have the other person in the room. I really don't like the aspect of advocating for someone or being a cultural link worker, unless that is your actual title. But we have to understand that interpreters do that a lot in terms of which word do I choose? How do I choose to put the question? Is that a question that I really reiterate so that the patient can answer that properly, and all those things that we cannot access only through an app?
Exactly. Maybe just to briefly conclude the interview, if there was one wish you could make for public service interpreters, because I understand you know their work quite well, you're in close contact with the practicing community, what would that be? The one thing?
Well, it's difficult to say one thing, but I think that in many aspects, there's no rule of law for interpreters. So, and that might seem harsh, but I think that it needs to be legislated quite simply. The European directive on interpreters in courts was a game changer for court interpreting, and that directive doesn't even say anything about the competence of the interpreter, which is quite mind blowing. But at least it states that an interpreter has to be there. There's an Australian researcher called Uldis Ozolins who says that as long as the society does not want to take the responsibility for interpreters, there's no way we're going to have interpreters in the public sector. So it needs to be really a systemic and societal responsibility. And that is when you put it down in legislation. And on top of that, it also, in the law, it also has to say that they need to be trained. Not just somebody in the streets who hopefully speaks that language.
Right, absolutely. Thank you so much, Elisabet. It's been absolutely fascinating to talk to you. And yeah, I hope to see you again.
Yes, thank you so much. And thank you for having me. It's fascinating to talk about what I love. So